Tasha has a question. She says, I was diagnosed with hypothyroidism, PCOS, and a blocked left fallopian tube and 3 fibroids that are about 2 centimeters. She wants to know what would be the better treatment for her.
Wow, so is it Tasha, Sasha?
Tasha.
Tasha. So Tasha has 3 problems. She's been diagnosed with PCOS, which just means that she's not ovulating. She has fibroids. And what was the third?
Hypothyroidism.
And hypothyroidism. Okay.
Yes,
so the hypothyroidism is easy enough to treat, and it should be treated. The fibroids, we can remove the fibroids easily enough. But the real issue is neither of those two might be interfering with her getting pregnant. The real issue is the PCOS. And there's a lot of confusion about PCOS. Usually it's associated with irregular periods and not ovulation. But in the old days, before hormone assays and ultrasound was so good, we used to think that PCOS was caused by being massively overweight, and women would have hirsutism and acne and massive obesity. Well, now we know that occurs in maybe, 1 in 1,000 cases of PCOS. It's really seen in thin women and women that do not have skin problems as well. And it's associated with, ironically, having too many eggs. And so those eggs suppress the secretion of FSH in the first part of the cycle. So they have irregular cycles and they never recruit a dominant follicle. And they either don't ovulate or they ovulate late in the cycle, which is poor quality eggs. So we treat that by stimulating them with a mini IVF protocol. We get all the eggs we need. We fertilize them with the husband's sperm. And then in terms of when we do the transfer, we want to make sure that we will operate on those fibroids if they're big fibroids. Now, if they're small fibroids, we don't worry about them. But if they're big fibroids, or if they're in the uterus itself, the uterine lining itself, then we remove them, and then she'll be fine 3 months later. So all those problems that she described are quite solvable, but it's going to involve IVF.